The last 18 months have seen an unprecedented global event take place with the rise of COVID-19 affecting over 170 million people worldwide. Some people have been left with long-term effects, so let's examine what exercise, if any, may be suitable. Hi everyone and welcome to Exercise for Health. I'm Richard and today I have exercise advice based on some early studies of long COVID patients. If you're new to this channel, we offer tips, advice and exercises each week to help you manage your health condition with physical activity. So go ahead and tap the subscribe button below and the bell icon if you want to be notified of when we upload a new video. There have been some small recent studies identifying patients that have recovered from COVID-19 but have been left with physical and psychological impairments to learn how physical activity has an impact on their health and well-being. Now, there isn't a wealth of data out there on this yet, but I was keen to get some information out there to help people that might be looking for it. But I will come back to review this topic again when more studies are published. Early evidence suggests that long COVID has similarities with myalgic encephalomyelitis, or ME, and chronic fatigue syndrome, and both fatigue and breathlessness are the most common reported symptoms of this condition. But there are many other symptoms including joint pain, poor balance, weakness, sensory issues and weight loss, as well as anxiety and depression following a reduction in capacity for everyday living. Just recently, the guidelines have changed for ME and chronic fatigue, whereby the recommendations for graded exercise therapy have been removed due to concerns regarding exacerbation. This highlights the importance of an individually tailored treatment rather than a one-size-fits-all approach. But long COVID is still very much a newly identified condition, which means we still don't know enough about the long-term effects of any prescribed exercise program. Therefore, based on the current research and my experience of prescribing exercise to people with similar symptoms, here is my advice for helping people with long COVID manage their physical health with the aim of feeling better. Firstly, and most importantly, take each day as it comes. Some days you may feel like not doing very much, and that's okay. Don't force yourself into a structured routine, but allow yourself to adapt to how you feel day to day. On a good day, you may feel like being able to do much more, but don't overdo it, as this could lead to repercussions over the following few days, also known as relapsing. So be conservative in your approach. So on the good days, when you feel you can be a bit more active, look to do activities that don't have a set goal. This could be taking a short walk outside of the house, maybe getting out into the garden, doing some of the things around the house you would like to do, but in small doses, taking part in an activity with your children, and if you've been feeling better for a while, start to venture out a bit further to include typical activities like shopping or dog walking. The aim will be to do what you can depending on how you feel. Make sure you listen to your body. If you're feeling particularly tired following a good day of activity, then don't think you're going backwards. Just know that you should work within your current limitations, and these may change day to day, week to week, month to month, and may not have a set pattern. The hard part to this is to find a way to balance your symptoms with your physical activity, because no 2 days may feel the same, and we don't know the long-term effects of physical activity with long COVID patients. If you feel well enough to take part in some form of exercise, then ensure that both your warm-up and cool-down is prolonged and gradual. Aim to then work the leg muscles to improve functional fitness for everyday activities, so this could be in the form of squats, step-ups or lunges, and also upper body muscle exercises to help with breathing, such as press-ups. Use a rate of perceived exertion scale of 0 to 10, where you should stay in the realms of 3 to 5 when doing any exercise activity where you feel a little bit puffed. Finally, if your breathlessness becomes too excessive, then adopt a seated position, leaning forwards, resting your hands or arms on your thighs. Keep the shoulders relaxed and breathe into the abdomen using the box breathing technique. This is where you inhale for 3 to 5 seconds, hold your breath for 3 to 5 seconds, exhale for 3 to 5 seconds, then pause for 3 to 5 seconds, and then repeat. You can do this between 5 and 10 times until your breathing comes back to normal. If you want some more breathing methods, then I've done a video that might help, so click on the pop-out banner above to see that one. I think for most people experiencing long COVID, they just want to get back to a sense of normality again with their life, whether that being back to work, being a parent, or doing what they enjoyed doing previously with their leisure time without the side effects. As more evidence comes to light over time, I will review this topic and do a follow-up video on it, as I'm also keen to learn more on how exercise can potentially help with managing this condition. I hope you can take something away from this video today. If so, please give it a like by clicking the thumbs up button below and share this video with friends to help this channel grow so more people can benefit from it. Thank you so much for watching, and remember to stay active, keep moving, and I'll see you next week. Thank you for watching. If you enjoyed this video today, please give it a thumbs up. You can also click here to subscribe to this channel or click here to watch a recent video. See you soon.